A few cases of Crimean Congo hemorrhagic fever or CCHF have been reported from district Attic, northern Punjab. Two of them died in Benazir Bhutto Shahid Hospital in Rawalpindi. One is being treated as an inpatient. Health and livestock officials are on their toes after the report of the index case from Hazro district Attic. I am Dr. Nadeem Sajjad Raja, specialist in infection. What is Crimean Congo hemorrhagic fever or CCHF? It is caused by CCHF virus. It is a tick-borne disease. Reports of several outbreaks with a death rate of 10 to 40%. It is endemic in Africa, the Balkans, the Middle East, and many Asian countries. Unfortunately, no vaccine is available to prevent this infection. The virus is found in wild and domestic animals such as cattle, sheep, goats. Some birds are resistant, but ostrich are susceptible, and they are responsible for one outbreak in South Africa. Animals get infected by the bite of infected tick. Virus is transmitted by the infected tick to human being. Then virus resides in their bloodstream for about 1 week after infection. Then another tick bites and virus transfer to that tick. Hyaloma is main vector or is responsible for Crimean Congo hemorrhagic fever. So how this disease is transmitted to human beings? There are two ways of transmission, either by infected tick bite obtained from infected animal or direct contact with infected animal blood or tissues during and immediately after slaughter. Mostly infected individuals are from livestock, such as agriculture workers, farmers, slaughterhouse workers, and veterinary workers. Human to human transmission can occur resulting from close contact with the blood, secretions, organs, or other body fluids of an infected individual. Hospital infections can also occur due to the improper sterilization of medical equipment, reuse of needles, and contamination of medical supplies. So what are the signs and symptoms of this disease? The incubation period is usually 1 to 3 days, maximum 9 days, from tick bite to appearance of signs and symptoms. The incubation period following contact with infected blood tissues is usually 5 to 6 days, with a documented maximum of 13 days. The onset of this disease is sudden, with fever, muscle aches, dizziness, neck pain, and stiffness, backache, headache, sore eyes, and photophobia. Photophobia is actually sensitivity to light. Nausea, vomiting, diarrhea, abdominal pain, sore throat. These are the early signs and symptoms, followed by sharp mood swings and confusion. After 2 to 4 days of illness, infection is replaced by sleepiness, depression, and lassitude. The abdominal pain is usually there, liver is enlarged, increased heart rate, enlarged lymph nodes, a rash caused by bleeding into the skin that is also very visible. especially on the mouth and mucosal surface of the mouth and throat and on the skin. Kidney functions and liver functions are usually disturbed. Respiratory failure is also very prominent. Death rate is usually 30% and occurs in second week of illness. In patients who recover, improvement generally begins on 9th or 10th day after the onset of illness. How Congo virus is diagnosed? Of course, history is very important. If there are already cases of Congo virus, then of course suspicion is very high. So the samples are taken. So these patients samples are extreme hazardous risk and should only be conducted under maximum biological containment conditions. However, if samples are inactivated by gamma rays or formaldehyde or heat, these can be processed in a basic biosafety environment. So what is the treatment? Supportive treatment is very important to alleviate the signs and symptoms, replacing blood components, balancing fluids and electrolytes, maintaining oxygen status and blood pressure. If there is a fever, then paracetamol, ribavirin, and antiviral is very effective in oral as well as in intravenous form. Thank you very much for watching this video. Please see my next video. So how to prevent this disease. Thank you very much.